Look, almost all of us get low back pain at some point. It's incredibly common. But what actually happens when you go to the doctor for it? Well, in this explainer, we're going to walk you through a real clinical case, step by step, so you can see exactly how it's diagnosed and, more importantly, how it's treated.
All right, let's do this. I want you to put yourself in the doctor's shoes. You've got your white coat on, you're looking at your notes, and your next patient is about to walk through the door. Your job is to listen, investigate, and figure out what is really going on here. Ready?
First things first, and honestly, this is the most important part of any consultation. You just have to listen. The patient's story has pretty much all the clues you're going to need to start cracking this case.
Okay, so let's pull up her chart. Our patient is a 35-year-old housekeeper. So she's young, but her job is pretty physically demanding, right? Let's hear what she has to say.
So as she's talking, you're picking out the key details. She says she's had back pain before, but this is different. It's way worse, and it started 2 days ago. Okay, there's a clear trigger, vigorous vacuuming. The pain is very specific. It's on her right lower side. And here it is. This is a huge clue. The pain shoots down the back of her leg to her knee. She's quick to add that there's no numbness, no tingling, and that lying down flat or taking ibuprofen seems to help. Your brain is already starting to connect the dots.
All right, you've got the story. Now it's time to gather some hard evidence. You need to switch from just listening to actually examining her to see if the physical findings line up with what she's told you. So you check her strength, her reflexes, her sensation, and it's all perfectly normal. That's great news, really reassuring. But then you do the straight leg raise test. As you gently lift her right leg up while she's lying down, she yelps. It brings on that same sharp, shooting pain down her leg. That, my friends, is a positive test, and it's a classic sign that a nerve in her lower back is really irritated. Okay, hold on. Before you jump to any conclusions, you have to do the most important job of any doctor. You have to make sure this isn't an emergency. It's time to run through a mental checklist of what we call red flags. These are the signs and symptoms that point to something much more serious.
Let's go through this together. You ask, any fever or losing weight without trying? No. That makes a bad infection or a tumor way less likely. Any history of cancer? No. What about pain that's so bad at night it wakes you up from sleep? Nope. Any trouble controlling your bowels or bladder, or any numbness in the area you'd sit on a bicycle saddle? She says no, and that is a huge relief. Those symptoms could mean a surgical emergency. And finally, any major weakness in your legs? No. You already confirmed her strength was normal.
So by running through that list, you can breathe a huge sigh of relief. You can be very, very confident that you're not dealing with something terrifying like cancer, a major spinal cord problem, or a serious infection. The patient is safe, and you can focus on managing a much more common problem.
Okay, you've heard the story, you've done the exam, and you've ruled out the scary stuff. Now it's time to put all the puzzle pieces together and actually name what's going on. So take a second and think about it. We have a clear trigger, we have back pain, and we have that classic radiating pain down the leg that you confirmed with the exam. And, crucially, no red flags. What do you think is the most likely diagnosis?
If you said musculoskeletal low back pain with sciatica, you nailed it. I know it's a mouthful, but let's break it down. Musculoskeletal just means the problem is in the muscles, bones, and discs. And sciatica is the specific name for that radiating nerve pain she's experiencing.
And look at this, because this context is everything. An incredible 97% of low back pain cases are musculoskeletal. You know, all the scary things people worry about, tumors, infections, they make up just 1%. This is probably one of the most reassuring things you can share with your patient. And just so we're all on the same page, sciatica is simply the medical term for that shooting pain she feels. It happens when one of the nerve roots coming out of the spine gets pinched or inflamed, a lot of times from a bulging or herniated disc. The pain just follows the path of that irritated nerve.
So, the diagnosis is made. The emergencies have been ruled out. Your job now changes. You're not a detective anymore, you're a coach. It's time to lay out a clear, simple plan to get her on the road to recovery.
But just as you're about to explain the plan, she stops you. She's in a lot of pain, and she asks, "Doc, shouldn't we get an X-ray or an MRI just to see what's going on in there?" It's a perfectly reasonable question, and one you'll hear all the time. So what do you say?
The answer is no, not right now. And this is such an important point. In a straightforward case like this, with no red flags, getting an image doesn't actually change what you're going to do.
In fact, it can sometimes make things worse by showing normal, age-related wear and tear that has nothing to do with the pain, which just causes unnecessary anxiety. Remember, you treat the patient, not the picture.
So here's the plan you lay out for her. It's way simpler than most people expect. Step 1, stay active. The old advice about bed rest is out. We now know that gentle movement is much better for recovery. Step 2, control the pain. You tell her to take an anti-inflammatory like ibuprofen on a regular schedule, not just when the pain gets unbearable. And step 3, you set a clear follow-up. Come back in 4 to 6 weeks if things aren't getting better.
And finally, before she leaves, you want to zoom out. This isn't just about fixing the pain she has right now. The bigger goal is to help her prevent this from happening over and over again.
So your long-term advice is all about prevention. First, you gently bring up weight management. Since she is obese, you explain that every extra pound puts more strain on the spine, so losing weight is a powerful long-term strategy. Second, you recommend exercises to strengthen her core and back muscles. Think of it like building a natural corset of muscle to support and protect her spine.
So after all of that, after the history, the exam, the diagnosis, the plan, what is the single most important factor that's going to get her better? What's the secret sauce here?
It's just time. That's it. It's the most powerful and often the most forgotten part of healing. The overwhelming majority of these cases, even with pretty bad sciatica, get better all on their own in about 4 to 6 weeks. Your job as the doctor was to be a good detective, rule out danger, manage the symptoms, and give her body the time it needed to do what it does best, heal itself.